Good morning, everyone. How are you? This is Girlfriends Pray, Real Talk, the truth about mental health. And we are so excited to have you here. I pray that you have text someone, post it on your Facebook page. Make sure you share, make sure you like, comment below. We're also on YouTube. So if you know anyone who perhaps doesn't have a Facebook account, you can invite them to our live stream on YouTube because we want to get the word out through all around the world, not just in our area or our connections, but everywhere. So I'm just so excited to be here today. Our topic today is seasonal depression during the pandemic. And our special guest is Dr. Ericka Goodwin. So we will be starting. I want you guys to comment below if you have any questions. We were telling people to DM, but I've since learned that you would have to come out of the live stream in order to send a DM. So we know that's not going to work well for us. We don't want you to miss any of the pearls that Dr. Ericka will drop for us today. So just comment below and one of our team members will definitely pull your questions and send them to me so that I can ask Dr. Ericka for you. So with no further ado, if I didn't say it, make sure again, like, share, and then on our YouTube page, make sure you subscribe so we can get more followers, which will help our content to be seen all across the world. So the more people subscribe, the more it'll be seen. Amen. Great. So I want to go ahead and again thank Dr. Ericka Goodwin for being here on behalf of our founder, Dr. DC Marshall. And also, if you're new to Girlfriends Pray, we have a daily prayer call from Monday to Friday, at 7 a.m. Eastern Standard Time. We are there on the line. And let me give you the phone number just in case you are new to Girlfriends Pray. I want you to know how you can call in. You don't have to say a word. Most people, when I ask them, to join us on the call, they're like, well, what do I need to say? What do I need to do? Nothing. We have an intercessor there that will cover you and your family, share scripture with you. And the phone number is 712-775-7031, access code 94334 pound. So make sure you share. We are here. So meet us every Monday through Friday. We're here during holidays, everything. We never stop praying. As long as the Lord our God is on the throne, we will be here. So I want to share our bio, Dr. Ericka's bio. Dr. Ericka Goodwin is on a mission to help you be better, do better, and live better. Come on, y'all. She is a Harvard-trained, double board certified psychiatrist, best-selling author, top-rated speaker, integrative lifestyle coach, creator of the hit series Groove with Dr. Ericka. She is a graduate of Spelman College, Emory University School of Medicine, and Emory University School of Medicine. She also completed her general psychiatry residency at Morehouse School of Medicine. Come on, y'all. She got all the qualification. She got all the things to tell y'all about seasonal depression. Come on, we got a professional up in here. So we are so happy to have her today. Dr. Ericka, you want to go on and come in and share with the our audience a little bit more personally about you?
Well, I'm so excited. Thank you so much for having me. I'm just so energized to spend quality time with your audience. And I'm laughing. You said I did all the things and you didn't even get to Harvard. I was like,
oh, I said Harvard trained.
Oh,
double. Yeah, I got that one.
That's what happens when you redo these bios.
That was the first thing. Check.
But I'm so excited to be here. I am, as she said, I'm Dr. Ericka. I am actually based in Atlanta, Georgia. where I just love being in Atlanta, and I'm just happy to spend time with women. I've always had a soft spot for women. I grew up around a bunch of women. My family is skewed towards women. They just happened to be, my mom had quite a few sisters, and they all have strong personalities. And then I went to Spelman. So to spend quality time just means a lot. If I tell you just a little bit more about me, I'm an only child, but I share. I know. I do have a private telepsychiatry practice. So I do see people right now, pretty much Georgia, Tennessee, Massachusetts, and Pennsylvania. But soon again, I'll be back in Texas. Oh, I also do California. Pretty soon I'll be back in Texas and Florida and someplace I forgot. Oh, Missouri. I have had a career as a traveling psychiatrist, so I've seen what seems like some of everything. And I'm just extremely passionate about making mental health practical. And if you think about who is Dr. Ericka, I'd say if the girl next door happened to be a Harvard-trained psychiatrist, you get Dr. Ericka.
Okay, amen. Well, today we're going to talk about seasonal depression during the pandemic. And I know this is something that has always been a topic of ours and sharing. We try to do this, especially seasonal depression, because a lot of people suffer from that. And I'm sure they had a lot of difficulties through this pandemic. So that's why we really wanted to focus on how people could be handling and going through during the pandemic. But can you share with us about seasonal depression in general?
Sure. So seasonal depression, and if you look in official textbooks, they'll say seasonal affective disorder, but I realize that is way too many words for a lot of folks. But seasonal depression just seems a little bit more descriptive. So what it is someone's mood has variance over the seasons, and people will notice that they feel worse during certain seasons and then they feel better during other ones. So the most typical pattern is fall, winter, where people have depressive symptoms more in the fall and the winter. And then when spring and summer are around, they typically feel better. There's a variant that's less common that is summer, spring. It's probably a little bit more common on the other ends of the equator because seasonal depression appears to be a little bit more related to distance from the equator, which is why in the US, you will see a little in Florida, but not that much, but you'll see a lot of it like in Alaska or even in Washington. So, but when people have it, they have like the signature symptoms that you would have with regular depression. So depressed mood, fatigue, problems sleeping or changes in sleep. Sometimes people sleep too much. Sometimes they don't sleep much at all, problems with concentration, all kinds of things. And you'll have those same symptoms, but they typically have this seasonal pattern.
Okay. All right. That's really interesting because sometimes you feel, I know some people suffer from depression all year long, and there's so many different types of depression. Like you see, at least for me, I see it on the TV sometimes about bipolar depression. So, and I never even knew that was even a thing. Like you hear about being bipolar, but I never heard it connected to depression, and it's all together like that. So can you share some information for those that may be struggling or maybe even haven't even identified that they're going through seasonal depression?
Well, and one of the things I want to say too is there are people that go through seasonal depression and they meet the criteria limit, as usually there's a certain amount of criteria, and then you say, you got this. There are people that have what feels like the winter blues, where they'll notice, I just don't feel the same or I feel a little off, but they don't necessarily meet full-fledged criteria for having a full depressive disorder. And there are more people like that. So about 5% of people in the US will experience seasonal depression, while about 10 to 20% may get this milder form where they just feel like they kind of have the winter blues. And I realized I lost the question. What was the question?
I was just saying, like, just talk about the seasonal depression, some things that we need to be mindful of, just to, even for ourselves as well as our loved ones. Okay. This like identifying, because for me personally, in my past, I've had a lot of things happen to me that a lot of people don't even know. So I lost my first son. My marriage fell apart from that. And my first son, he was only 5.5 months old. And after that, it was the marriage, and so many things started happening. I wasn't connected into my stepdaughter's life, who I had known her since she was 8 months old. And then I actually started identifying that when it comes to November, December, I am very low. Like, I don't necessarily celebrate those. Like, I love Thanksgiving mainly because I get to eat. There's another thing about depression, but I don't necessarily have the spirit that everyone else has when it comes to the activities of during that season of holidays. So could you talk more about that?
Well, and you bring out one point that is huge, which is we have all these names of stuff.
Mm-hmm.
People are human beings. So sometimes people don't always fit into just one box. And there may be more than one thing going on, or it may just have an overlap. Mm-hmm. And one of the things that's common that I've taught to patients and clients is that a lot of times with some of these seasonal variants, and also when you talk about kind of things being episodic, also when people have things that just happen around their cycle, that the interesting thing is a lot of times people may not recognize that it has that episodic nature or that it's during these seasons, but someone else will notice it. So they'll have a loved one like, this seems to happen the same time every year. And sometimes it's someone that's around you that notices it. And then kind of having these issues around the holidays, there are times where it could be truly a seasonal variant, or it's not uncommon for people that have issues with their mood or have experienced significant loss to not necessarily feel in the spirit around these major holidays, that these holidays tend to be triggering because it reminds them of all of their loss or their trauma, or how things aren't the way they were. Like, one common thing is for a lot of people that have lost one or both of their parents, that adjusting to those times of year when they had all of these memories or ways they would celebrate and then they're gone is very, very difficult. So I think there are times where sometimes it's more of that loss and grief, and there are times that it may be a seasonal variant because those seasons happens to be generally in winter.
Okay. Yeah. So like for me personally, I wasn't even diagnosed like from a professional, not even my primary care physician who I shared that with, but I really recognized that in myself. And I just related it back to like the holiday where you celebrate. It's more for the kids. So I identified that that's my mood. Like, I slow down. I'm not very vocal. I'm challenged to do different things involving other people. I more or less isolate myself. So can you tell us maybe some helpful hints on what we should do and things we should identify with?
Well, I think one of the things is to release this expectation that we're all supposed to do all the things. Mm-hmm. Because especially as women, there's this pressure to do all of the things. And it's not just one little thing, especially when you start talking about the holidays. It's, you've got to get the house together. You've got to get everyone's gifts, everyone's treats. If you have people coming, then you've got to get ready for that. Or if you're going somewhere, especially pre-pandemic, well, then you got to get the hostess gift, but you have to have the meal and stuff ready at home, even though you went somewhere. It's just a lot of stuff. I've got to decorate. I've got to, and then it's like, if you have kids, the kids have programs, the kids have this and that. Or if you're divorced, well, I got to take them over here for this day. Then they come to me for this day. And it's all this going back and forth. And then, if you have family that lives in town, back in the day, you'd be like, well, I do this part of the day is with my mom's family. This part's with my dad's family. It's just all of the things. So I think one of the first things is to release yourself from the pressure to have to do everything and to do it big. Sometimes, and that was probably one of the beauties of this pandemic, is I know a lot of people realize how much better they felt when it wasn't doing these big dinners and all these humongous plans. And it was just Okay, let's have something small at the house with us, with the family in the house. And then it was over and done. It wasn't all of this going everywhere, doing all the things. And I think the first thing is releasing yourself from that expectation that you just have to literally do all of it. And then if you have resources, start thinking about ways that you can source out some things. You know, most of the time, if you don't have little itty bitty kids, they can even help do things. So having your family in the house help do things. If you have a spouse or adult family in the house, having them do things, having things delivered. If you can have food delivered or do the drive-through pick up groceries at Walmart, so you're not sludging through. And you know, if you're comfortable, especially pre-pandemic, and you have the resources, have someone clean the house or hire someone to hang the lights. Just kind of pulling some of those responsibilities off, making sure you make time to get some rest, that you are intentional about setting a bedtime, and just do a hard stop, that whatever isn't done by this time isn't done. I'm going to turn my phone off. I'm going to go to bed.
Right.
And doing that for your kids too. Like, y'all need to take your little butts to bed. This is when you go into bed. I'm taking electronics, you go into bed too. Because a well-rested house, you're going to be in a better place to be at your emotional best, and to actually identify one or two people you feel comfortable talking to about how you're actually feeling or how you're actually doing. And that may be family, it may be friends, but if you have one or two, it's kind of like phoning a lifeline that you feel like you can call and not feel judged. And it's something as simple as, you know, my kids are getting on my last nerve. I really want to sit them outside the house and leave them there for a week. Or I don't feel like cooking one more meal. Or if we had McDonald's every day for a week, I wouldn't care. Whatever, you know, or if you just feel tired, like I'm just tired, but someone that you feel like you can actually talk to about the inner workings of your mind. And the last thing is, if you just feel really overwhelmed and just are just feeling terrible, or you don't feel like yourself, or heaven forbid, you're starting to have thoughts of, you know, what would it be like if I wasn't here, or everybody would be better off if I wasn't here, then, you know, get some professional help. But there's also an intermediate where people may not necessarily want to go see a licensed mental health care professional, and they may seek assistance with the clergy.
Right. Now, speaking of that, sometimes I know from a Christian background, and I was raised from, like, I'm one of the ones from the womb to the pew. So coming up in the church, a lot of times everything is in regards to talk to the pastor, or pray, or, you know, do whatever you need to do. You need to read your Bible more. You need to have devotions. Like, not saying that God isn't able, because he truly is, and he can release anyone from any struggle that they have. But I think from even a cultural, for African Americans especially, it's more of a taboo to seek out professional help. Like, if anything, you'll just go to see your pastor, as opposed to those things where sometimes your pastor, even as anointed as he is not equipped professionally to help you when you have true psychiatry things going on, psychological things going on. Can you talk about or encourage people about the importance of seeking out professional help?
Sure. You know, and when we start talking about pastoral counseling, or counseling within the home of the church, it's one of the reasons why a lot of us have done work together, is so that people kind of have a really good idea of where possibly their limitations are, where I can comfortably and confidently support people, versus, oh, you actually need a higher level of care. And I have to say, a lot of churches has been doing a lot better about kind of recognizing when someone needs a higher level of care. And I think one of the things to keep in mind is we are all vessels that are filled with some type of godly energy. Like, God uses all of us. God created us, and God uses all of us. And I think sometimes people don't keep in mind that as God is using all of us, that he can use us and move through us and work through us. And just as if someone has diabetes, and, you know, we don't necessarily pray over your diabetes, or you broke your leg, you don't pray over your broken leg.
Exactly.
You go get seen and someone fixes it. That it's not a statement of your level of faith. And I feel like that's been one of the huge issues when it comes to mental health, that for some reason they look at mental health as a statement of their faith, that if I get help for this means I don't believe in God, or I don't believe God can fix it, or I don't believe God is covering me.
Right.
God can still cover you and bless you and work through someone else to help you get better. And because mental health issues are just like any other illness. And I think it's reminding people that he can still work through us to help you. And God would never want you to just suffer for no reason.
Exactly.
And one of the things that hurts my heart is seeing people suffer needlessly, especially with mental health, when they could get some help and be feeling much better and be able to claim that life that they were created for. But they're uncomfortable with seeking help, so they're suffering. And when they suffer, the people around them suffer.
Right. Yeah, that I try to encourage people, because I hear a lot about that very thing, that I'm trusting in God, or I'm not going to claim it. Well, you don't have to claim it. It's happening. Whether you want to acknowledge it or not, that's another issue. But it's happening, and you need to seek professional help. I know people who have struggled in depression but won't take the medication, or won't take it because they don't like how it makes them feel, but that's part of the process. And I try to encourage people, because after we had a house fire in 2017, and I was dealing with post-traumatic stress disorder. Did I say that right?
Yes,
I always get it mixed up.
You got it all together.
Yes. So, and because I was really having, I think it's called terror dreams or something like that.
Oh,
Yeah. And it was really bad. I was consistently dreaming of saving my family from a fire. Either like in the fire, I couldn't put it out, but it would pop up in the craziest things. First is water, then it's fire. Or one time I was having a dream of a tsunami had hit, and I had to save my family from the water, and I wasn't getting any sleep. So she prescribed me a medication, Lexapro, I think it is, to help with that, and as well as something for me to help me with sleeping, because I wasn't getting enough sleep. And she told me, she said, Kim, you're not going to function if you don't get enough sleep. And I remember you saying that earlier about getting enough sleep and how important it is. And she told me, my psychiatrist told me, you need to sleep. I can't help you if you don't sleep. So that's where we were working on. And then a very good friend of mine, she was like, do you recognize that you may have to take that medication for a long time, or even the rest of your life, because that traumatic experience is not going to go away from your psyche. You're not going to just forget about it. So you need coping mechanisms, and the medication is part of that coping. Can you talk about, from your professional line, how sometimes people have opinions of medications, and how helpful medications are?
Well, the first thing is the average person doesn't understand what our medicines even do. So I literally hear the same thing every day. Like, I don't want to be a zombie, or I don't want to be zombified, or this is going to change me. And I think the first thing is people don't understand what it's supposed to do and how it's supposed to do it. And the next is being able to find someone to work with that you feel comfortable is going to listen to whatever you have to say, because people have fears because they don't necessarily always understand, or they've received all these mixed messages. And I want someone, whoever they see, to feel comfortable. If you're uncomfortable, or you're like, I'm just afraid this is going to jack me up, because folks are like, this is going to mess me up for the rest of my life, this medicine you're going to give me. Or to be able to talk about your hesitance, your concerns, or if you take it and you don't like the way you feel, because naturally, I don't want to give you any medicine, because as a psychiatrist that went to medical school, I can prescribe. My personal mantra is minimal medication for maximum effect. So I'm not really heavy-handed. But sometimes people need it, but you have to be able to have an open discussion around it. And someone needs to feel comfortable if you're having difficulties with it. If you feel kind of wonky, or you feel tired, or you feel kind of amped up, or one of the common things for antidepressants is sometimes it affects people's libido. And for men, it actually may cause some difficulties with maintaining erections and those kinds of things, is to be able to have an open conversation around these. Because I realize did I just start talking about sex on Girlfriend's Break?
Fine, no, but this is real talk. This is real talk.
That's probably one reason a lot of people discontinue their medicine, because they're like, wait, is to be able to have open conversations about all of those things so that you can get a customized plan that you feel comfortable and safe with. That is going to be effective, because there are a lot of non-medication treatments that we all have in our toolboxes, but there are times where people are having a level of, and what we typically look for a lot of times as the deciding factor of medicine or no medicine is, there's one where we use a lot: impairment. So the level of impairment, how much is it getting in the way of your everyday life? And sometimes it's getting in the way so much that there's not really an alternative that's going to be effective. And that doesn't mean, I'm a fan of, you don't use medication alone, use other things with it, because you want people to be able to be at their best. And that includes therapy, that includes, healthy diet, exercise, sleep, all kinds of stuff. But I think it can be important for people that need it, but you have to be able to have that open conversation. And if you feel like you're seeing someone that you feel like literally just does not listen to you, because unfortunately it happens sometimes, then it just means you need someone else. Seeing a psychiatrist or a therapist is like dating.
Yes.
The first one isn't always going to be the right one. And just because it's not the best fit, because there are so many different ways to do this work.
Right.
People have different temperaments, different styles. If you feel like someone doesn't match well for you, it doesn't mean that treatment isn't for you. It just may mean that that's not the person for you.
Right.
Just like we've all dated people, and it's like that person's a good person. They're a good person for somebody else. That's just
exactly.
And I think it's sometimes people feel like if they meet one that doesn't feel like it's a good fit, that means this isn't for them.
Yeah, because when my first son, Terrence, he passed away, I actually was hip hopping through counselors, because I felt that exactly what you stated. Like, I didn't feel like they were for me, and I felt like it was my right to feel comfortable. And until I do, I will check out and find someone else. And it wasn't that I didn't think I needed it. It's just that it wasn't a good relationship for me. So for me personally, I look for someone who has the professional certification from a clinical aspect, as well as a spiritual connection as well, so that you can feel me. And it took time for me to really figure out what I needed for me. Because for me personally, I feel like from the professional era, you can only take me but so far, but I need the word. I need you to be sharing some powerful word in me to take me where I need to be, to really walk in what God has created me to walk into. So I did do a little bouncing around until I found that right person to help me through it. And he was awesome. Like, he really, he pulled me, he challenged me. He didn't fall for my good smile, because I can smile my way through. I can laugh my way through. So he was able to see through it all. So he was really perfect for me. So I'm glad you shared that, because it's like you said, it's like dating. You have to find the perfect match. Is there any other like tidbits or things that you can share with us about the seasonal depression, and even depression in it of itself?
Well, I'd say one thing that a lot of people will use when it comes to seasonal depression is they'll talk about light therapy. And it's probably become even more popular, because back in the day, they used to call them sun lamps or light boxes, and there were these big old contraptions that you had to order from the equivalent of medical device makers. And now you can get one on Amazon that, is this big, and you can take it anywhere. And that's one of the common things that we'll use for seasonal depression, because part of it is related to the changes in the sunlight.
Mm.
So that gives you more light. So it almost is kind of simulating that light for you. And people will use a 10,000 lux light for, 30, 45 minutes a day.
Okay.
So that's something that is a little bit different. We'll still sometimes use it even for regular depression, but it's very well known for its use in seasonal affective disorder. If I had to say limited amount of time, big pearls is, I'd say the first thing is if you don't feel like yourself, there's nothing to lose by just getting checked up.
Right.
I'm a big fan of the mental health checkup. And, just the other day I saw someone, I'm like, well, you don't have a mental health diagnosis. There are a few things you want to work on. We can work on those. But it's fine to just have someone just to check out, just like you would do a physical. And sometimes you get your physical and they're like, you're A-okay, you're good. And then that's it. And then you come back a year later and it's like, okay, what's up this year? And I think for a lot of people, and it's interesting when you even look at TV, there were some shows in the 90s that I feel like I didn't even pay attention to the fact that, like on Girlfriends, everybody had a therapist.
Right.
I watched it after being a psychiatrist. Is that sometimes it's great just to have someone that you can talk to, that you don't feel like you're going to burden, that you don't feel like is going to either weaponize your vulnerability or has any personal stake in it other than you doing well. So sometimes it's nice to talk to someone that's non-judgmental to help you kind of walk through things. If you just don't feel like yourself, go just get checked out. Just see if there's something going on, because just like any other thing, like if someone just has a touch of the sugar, then we can work with your diet. If it gets to be a hot mess, you're going to be on insulin. Would you rather some diet tweaks? The insulin. And for a lot of what we have, it's like if someone comes to you when it's minor, then a lot of times some of those interventions that have nothing to do with medication are very effective. If you come to me when you're suicidal, then most likely we're going to be looking at medicine, because we have to get everything wrapped up and taken care of immediately. Right. So I think it's having that internal barometer to realize when you're out of whack. And sometimes it takes nurturing that self-awareness, because we get used to feeling out of whack. The out of whack feels normal. The feeling tired feels normal. The not sleeping feels normal. The being irritable feels normal. The just feeling like things are blah, because that's one of the big symptoms of all types of depression. You can sound really smart. There's a word called anhedonia. Anhedonia.
Okay.
All it means is you just don't find pleasure in things. So literally it's the blahs. It's everything feels blah. Like the things that you used to have fun doing just aren't fun anymore. You don't enjoy them. You don't really enjoy anything. And the two things that we probably don't talk about is that, and sometimes people just don't feel motivated, like getting out of bed or doing things. It's like they just do the bare minimum because they have to. But I think the biggest thing is just becoming self-aware and being able to notice when you're out of whack and could just need a little bit of help.
Right. That's really good information that you're sharing. I was looking through the comments as you were speaking. Someone talked about it being costly with finding the right. It could be costly finding the right psychiatrist or counselor for you. What I would say for that, number one, when I'm talking about me personally, I feel that I am very important, and the cost for anything else in my life, I don't necessarily think about the cost when I'm trying this makeup or that makeup. I don't think about the cost when I'm trying these new shoes or this, all the outward things that make us think we feel, that help us feel better about ourselves. So for me, you need to manage that cost expectation and the fact of what is most important for me. And me seeking help, I didn't, even when I was trying to find that person for me, I never even considered about the money aspect. I knew I needed help and I needed to find the person that was right for me. And money was not going to stop me finding that right person, because what good is it to sit under someone that you feel is not the best for you? And the worst thing to do is just say, okay, this isn't working, I'm going home. No. And the other thing I would say, most larger companies have an EAP program, and that's an employee assistance program that gives, at least my job, it gives us a few sessions for free. And some counselors will even have like a charge on a scale. So they look at financially how you are stating. So just ask those questions. Don't be afraid to ask questions about costs, if they accept the EAP program, all of that. But I don't want anyone to shy away from getting help just because of financial concerns, because counselors are really in the profession of helping you. And from a psychiatrist, we know your insurance doesn't cover everything, and some psychiatrists are willing to work with you as well. So don't let that be the stop. Don't let you getting help be a financial thing. Go right ahead.
I know I had to put the church finger up. And there are a couple of different kind of strategies when it comes to managing costs. If someone either is underinsured, has no insurance, or a lot of times Medicaid or Medicare, there are community mental health centers. So a lot of times you can just Google community mental health center and it'll tell you what's up in your area. And those facilities also get grants so that the money that they use to operate is not totally what people are paying those. So a lot of those for people that have limited income and limited coverage can be free. The next thing is that someone you both mentioned, well, people in the chat and you mentioned EAP. A lot of people will also take your health savings account, so your HSA. And, sometimes people are covered, sometimes they're not. And some of us actually have cash-based practices. So you can kind of figure out, kind of get in where you fit in, per se. But I agree that sometimes we don't put the same value on our mental health that we put on other things. So we'll put a higher value on having a really good purse or a jewelry or some really great shoes or the spa. And at the end of the day, what's your mental health worth? And I think it's priceless, because if you get your mental health together, everything is going to be better versus slogging through. So I'm a big fan of investing in yourself, but I just want to give a couple of resources.
Yes, please.
If someone literally just doesn't have it.
Okay, great. And if you could, towards the end of the session, share those resources with me, and we will post them on our Girlfriends Pray page. We will post them in this chat as well as on our YouTube, so that we can make sure that the people get the resources that they need. Is there anything else that you can share with us? Because I really want us to be mindful of what we need to do and how we need to take care of our mental. But I did want to ask a question that I had, Ashley, about the light. Can you, how the sunlight affects us? Can you talk a little bit about that, how that really works?
Well, what it is and what's going on when it comes to these seasonal variants is the amount of light affects the amount of melatonin production and serotonin. And it's believed that at times where, since we're having less sunlight, then it's an overproduction of melatonin, and then it'll make people feel sluggish. But the interesting thing is, depending on which variant, sometimes people will either be overeating, super tired and fatigued, and sleeping too much, or if for the spring summer variants, a lot of times people will actually be more irritable, restless, some agitation, and actually be sleeping less. But as naturally, none of this stuff stays all the way in the boxes. But the big thing is just that those shifts of sunlight in our circadian rhythm can affect mood.
Okay.
But I have a church finger one more time.
No, go. I talk a lot. Cut me off.
No worries. And the other thing is, I saw something in the chat, and I wanted to kind of address it very quickly, is that one of the reasons it's important to see a licensed, skilled professional is that a lot of things look like a lot of things. They look like all of the things. So one of the things that being trained as a physician that psychiatrists are really good for is that there are some physical conditions that masquerade as mental health. So issues with thyroid, also people can have anemia and be depressed. They're just a very wide variety of things. And it's always good to see one of us sometimes because we can do some assessment to figure out, is what you're even dealing with a mental health issue to begin with? Because sometimes people feel like they have a mental health issue, and if it's your thyroid and I'm just doing therapy, or someone gives you an antidepressant, but you're hypothyroid or underactive thyroid, that's not going to fix it anyway. So being able to tell the difference between what's physical that may be causing you to have mental health issues, and someone also made a comment of trauma and things looking like different things, is that we have a lot of overlapping symptoms. So it's really good to have someone that is skilled to be able to tell, is this a depressive disorder? Is this anxiety that someone just secondarily feels a little down? Is it bipolar and you're just in a depressive episode and you're bipolar? Is the primary issue a trauma-related issue and you just happen to have some depressive symptoms, but the primary issue is trauma? And especially in the Black community, a lot of people have experienced trauma. And then also, we're a community of women on this situation right here. And one of the average is around 1 in 5 women have been sexually assaulted. And there's just so much trauma. There's trauma, the trauma being Black. There's just so many levels of trauma that people have experienced, and it's become the expectation that everyone somehow fix their own trauma, or they don't even recognize that they've experienced trauma. I can't tell you how many people that I ask, have you had a trauma? It's blah, blah, blah. And either they're like, no, if you just ask if they've had a trauma, or you start asking, and then you figure out all these things that have actually happened to them that they have somehow normalized. So it's important to have someone skilled. And I think the other thing to remember is psychiatrists do more than just prescribe medicine. In my practice, I actually have quite a few therapy clients that I'm not prescribing at all. So we're not just prescribing medicine. So it's always good to have options.
Absolutely. Absolutely. And that's a good point, that it's not just about medication, because a lot of people don't want to take medication and they want to be able to cope and deal with things without being just given medication. So thank you so much for sharing about that. I don't know if we had any questions, but ladies, if you do have questions, you can definitely post them in the chat, and one of our Girlfriends Pray team members will make sure that I get that question to Dr. Ericka. So please make sure that if you have any questions, also share it with your friends and your family on your social media platforms, so that people will know some good information about depression. We don't want to ever feel like anyone is just sitting and being isolated and need to have help. I know, like for me, Dr. Ericka, for my mom, she's been dealing with depression for a long time. It started with her having a traumatic brain injury and just coping with basically having a life-changing event where she was a top VP at a bank, PNC Bank, and now she had to learn how to read, write, walk, talk, the whole nine, all over again. And now, even though she's actively working, she still deals with the limitation part of it. Can you talk about how sometimes, or talk more about how that impact happens from having some form of medical traumatic experience that sometimes also develops into depression?
Well, there are quite a few medical or physical issues that can automatically have that. So you mentioned a traumatic brain injury. It's also common to see mental health symptoms in people with seizures. And, naturally it makes sense, because mental health sits in your brain. So if something happens to your brain, there's a chance. Along with, there are some things that are more acute that we really don't have to spend a lot of time on. Like, I think everyone's seen the cute little old person that has a urinary tract infection that sees stuff and is fighting.
Right.
And that's like a delirium when someone has a physical process going on that just like immediately changes things. And that type of treatment is not typically what most of you are going to be dealing with. But it's something I like to bring up, just because, especially if you yourself are an older adult, or you have parents, or you're in a field, or you're in the church and there are some senior members in there, is that people start seeming kind of off, that's especially in that age group. The first thing we look at are urinary tract infections or other things like that that may actually be masked. That's something else that'll masquerade. And also when people have problems with their blood sugars,
Mm-hmm.
that can also look like mental health. And then there are certain classes of medicine that can cause some mental health looking stuff. Like there are a couple of antihypertensives that are also used with some cardiac issues, and also like post stroke and post heart attack. You can see those things too. So it's always good to have a wide view, and that's one of the things I encourage people. And one of the things I pride myself on is having a big view, kind of like looking at things on the big screen instead of just at a microscope, because sometimes seeing the full picture helps you be able to put together a better plan. And, talking about medical trauma, not only things such as a traumatic brain injury, but for some people, being in the hospital itself is traumatic, that especially people that have had significant medical issues and they've been poked and prodded and had procedures that were scary, especially for kids. It can be difficult. And right now we're also dealing with it being a traumatic experience for a lot of people that have experienced COVID, that feeling of not being able to breathe or wondering if they're going to make it, or even possibly being intubated, or just not feeling well for so long, that itself is a trauma, along with the fact that they're starting to see some post-COVID or COVID-related mental health issues. So I think a lot of it is just making sure that you have a comprehensive team to help really work through what the physical is and what's going on from a mental health perspective, to help people feel like they're getting to a place of productive wholeness.
Yeah, because one of the things, like during the pandemic, we went through something like no other. And then those that had to be isolated, and some being isolated by themselves, not being, because they don't live with anyone, they live by themselves. And now they went through a year of just being in the house by themselves without any outlet. So can you talk a little bit about that? I know you probably have experienced some of that with your clientele.
Well, it's been a challenge, because I think the first thing we've seen is there are people that you thought would have struggled being by themselves, that they're living their best life, because they're like,
Yeah.
I stay home, I don't have to deal with all these people I had to deal with. I'm connected with my inner introvert. This is my jam. But there are a lot of people that it's just been really, really tough, especially for older people or people with a lot of pre-existing conditions, especially if you didn't have someone already in your household, is that loneliness had been studied prior to COVID, and people were already struggling with loneliness, especially our older communities. And then you add something like COVID, is that it's just been very difficult. So we've seen a lot of people start presenting with mental health issues that previously weren't seeking treatment before. Either they didn't really have symptoms, or they felt like their symptoms were manageable, and COVID just pushed them over, because it's the combination of the isolation, along with, people that actually believe COVID actually really exists, the fear of there actually being a reality-based infectious disease out there that can kill you, along with all of the changes that have happened, because it's not just the isolation. For a lot of people, it's the fact that their home no longer is for home stuff. Home is work, home is school, home is everything, and trying to find ways to put boundaries and things, and redefine the roles in the household. And I think that's been a huge struggle for a lot of women, is when all these shifts came and everything came to the household, is that all these tasks that were now new household tasks, God rest men's souls, is that a lot of times those roles all shifted to women, that it didn't end up being this equitable split of everything new in the home. It's kind of like kids need school and they need planning and they need all this stuff. Okay, here's for the ladies, this for the ladies. And it was just really overwhelming, So I think it's been this thing that has shined a light to make everything that was already there worse, and to bring new things in. And the other thing about the isolation that I want to bring up, I feel like I'm talking too much, is there also has been a lot of fear around going to the doctor or going to the hospital. And that's been one thing we've seen that's been difficult, was that by the time people show up, that they're actually sicker. This mental health patients were sicker, but also other people, sitting at home having a heart attack because they're afraid to go to the hospital. So I think one of the things we've all been working on is finding ways that we can either, if we can't do it virtually, trying to have the safest environments for people to get the care they need, so that people are not dealing with these severe issues at home and potentially dying, having strokes and heart attacks, or, their blood sugars are a disaster because they haven't been checked or haven't been seen in forever, or people have these cancers that are gone wild because they didn't do their screenings because they're afraid to go to the doctor. Is that now that there are some, it's a little bit safer. I still believe COVID's out there. You still have to take all of the precautions and not just be kicking it just because. Right. But to still do your health maintenance. And if something is going on and you're having a real difficulty, or you're in severe pain or something like that, to still go get seen. Because the last thing we want to happen is people are isolated, they're home, and then they're super sick on something that could be taken care of, or at the worst case scenario, they die over something that could have been intervened.
Right. Yeah, I actually was watching one of the medical primetime shows, and it was interesting. It was New Amsterdam, and it also was, I think it was not Chicago Med. Yeah, I think it was Chicago, one of them. But one, it was a woman who she had cancer, but she needed to continue her treatment. But because of COVID, she felt like she was safer at home. And then it was a gentleman who had a heart issue that he could actually die, but he was so fearful of getting COVID that when they wheeled him into the operating room, he freaked out, ran out, but they had to find him in the halls. He was completely naked. That wasn't even of concern. His concern was catching COVID. And when I seen both of those, and I was like, that's probably true life. Like, there are people who are so concerned that the fear grips them, and they need to seek out help to get past it, to even seek out help that they need, they know they need. It would be a detriment to their life. So yeah, that's really real stuff, and hopefully people seek out what they need.
Yeah, and I the interesting thing is they portray psychiatrists extra special on all the shows. Chicago Med, I love the dude, but his boundaries are a little iffy sometimes, and Iggy's boundaries are terrible. I'm like, you have no boundaries. So just know, on television, we don't really do things the way they do on TV. Because
yeah.
They willy-nilly. I'm like, no, you wouldn't put someone in restraints for that, or commit them for that. You can't do that. Right. That's not real. But I think one of the big things is just being aware. So there's a question in the chat, a comment in the chat about needing a primary doctor's referral, and that person saying they don't need it. And I think one of the biggest things that's important for all of these things, especially being Black and being Black women, is being active advocates for your health and the health of the people you love. Because unfortunately, there still are significant health disparities. There still are all these myths of all of the things Black women are, that we don't feel pain, or that we're so strong, we don't need any help. And I think some people's barrier, that they're thinking you have to be a total disaster to need one of us. And I think that's doing people a disservice. So you have to just unfortunately continue to advocate yourself and not let them tell you no. And if there's a point where with any kind of doctor, be it primary care, mental health, or whatever, that you feel like they just don't listen to you and don't hear your needs, then it may be time to look for another one.
Yeah. And also know with your, just be in tune with your health insurance too, to know what they offer you. And a lot of them do offer, they have psychiatry, and they help you get treated for what you need. So that's really good to know too. Is there anything else you can maybe share with us in regards to this topic?
Sure. I'd say, the first thing is starting to become self-aware of kind of how you're feeling. The next is really paying attention to how you're doing and giving yourself a higher standard. I think for a lot of people, the standard of I'm okay is I'm surviving. And I would love for people to move past survival being the benchmark of being okay. I don't want to necessarily, I feel the thriving feels like it gets so overused. I don't want you to thrive. I want you to thrive. But, we want people to flourish. I want you to feel like you were able to have that life that you were created for. I want you to feel like you're not constantly walking in a test that God gave you. Because sometimes I think that's the other thing from the spiritual element is people will sometimes normalize the struggle because they feel like it's a perpetual test of their faith. And I want to encourage people that I honestly don't logically and spiritually believe that life was created to be one big perpetual test of faith.
Right.
So that I want people to start normalizing feeling good instead of normalizing survival, and realizing that getting past all of this self-talk around this idea that to have a good life, you have to be happy all the time. And Dr. Fredrickson even talks about 10 positive emotions. There are a lot of positive emotions that aren't just happy. And some people discount where their life is or how they're feeling or beat themselves up because they don't feel like they're just happy all the time, and don't give enough weight to other positive emotions. But I also want you to be open enough to be able to feel those. And then if you're in a space where you feel like every day just feels like a struggle, or it's kind of like the best it gets is tolerable, then that's not acceptable. And I think the thing is Black women make tolerable look good. Because we've been taught to just make it happen, pull it together, hook or crook, just make it happen. And we end up making it look like we're doing better than we are, because we're used to there being a baseline level of things. Not only do we have to do for our survival, but the survival of our family and the survival of our community. So we're used to, you just got to make it work. It doesn't matter how you feel. It doesn't matter how much energy it takes. It doesn't matter if as soon as you do it, all you do is lay in your bed and cry, but you just have to hit this level and just get it done. And I think we have to stop normalizing that. Number one, it's the expectation that we get all the things done, but the fact that if you get it done, then you're good. And for a lot of people, they will push through. There's food on the table every day. Their kids' clothes are clean. They've cleaned the house. They've done the laundry. They've helped with the homework, and they feel like crap inside. But they technically checked off all the boxes of doing the things. And I just want to say you deserve better.
Right. And that gave me a thought of you deserve a life worth living, not just checking a box or getting it done. You deserve a life worth living. And some people, they'll say, "Oh, I'm a 10. I'm on a 10." But are you really? Are you really on a 10 every day, all the time? Because there's things, like you said, in that quiet moment, you're struggling inside and you're putting on a show to just turn it on. And it's not that simple all the time. It's not that simple. So that is so true. So thank you so much for sharing that. So ladies, if you have any questions for Dr. Ericka, please post, comment below so that we could share your questions. We have Dr. Ericka Goodwin, who's a double board certified licensed psychiatrist from Harvard. So we bless God for having this opportunity. So this is the chance you can take to ask a doctor, a real doctor, a licensed doctor, to share some thoughts you may have, because depression is real and we want to help you break through and get the help that you need, and ask the questions so that you can take that next step. Anything else you wanted to share? We have a few more minutes. And also, because it seems like we're just doing really good. I don't see a whole bunch of questions, so we must be hitting the mark.
Well, there was one I saw in the chat, and they asked, what does a mental health checkup consist of?
Mm-hmm.
So how I would put it together is it's going to be a full evaluation.
Mm-hmm.
Also in the concept of you don't have to be a mess to be getting this full evaluation. So the main mental health evaluation that like a psychiatrist does includes a few different pieces of history. So we talk about how you're doing now. We talk about your history of how you've been doing over time, any past history of any mental health care. We talk about your medical history, so anything that's happened to you physically, from surgeries to head injuries to seizures to any other major medical conditions. We talk about any medications or supplements that you're taking. We also talk about what your family history, like what kind of illnesses have popped up in your family, from a mental health and a physical health standpoint, and also addiction or developmental issues. We talk about what we call social history. So it talks about kind of your family, what your relationship is, your family, what your childhood was like, what school was like, what your current relationships are like, how has it making friends or having meaningful relationships, work, job, all that stuff. And you just kind of go through a full history. But to me, what makes it a checkup is you don't have to go just because it's a mess. So I still would ask all the questions I would ask if someone actually was on the struggle bus. But it's just good to know. But we still get a full history just as I would for anybody else.
Yes. Another question we had was, when you have depression, why are you a master at hiding it?
There are a couple of reasons. One is, I can say this in this room, given who's in here, 'cause you're Black.
That's the truth.
Being a Black person, especially a Black woman, the one thing everyone is an expert in is wearing some version of a mask and providing people what we feel like they will be comfortable with. And just as we do that practically around the whites and at work, we practically do it in our personal lives too, where it's easy to do that because, number one, you're conditioned. That's what you're conditioned to do. You're conditioned not to make people uncomfortable. Part of the reason why is because making people uncomfortable can be at the worst in death, because somebody hurt you because they are uncomfortable with you.
Right.
So you are so used to putting up that face that it becomes natural to do that, because also, just as women, we are people pleasers. We want to make people happy. We want to take care of people. We don't want to disappoint people. And this feeling that if people know how we're really feeling, that they might be uncomfortable or they might feel some type of way about it, or they might not support us, is that it's easier to hide it than to be vulnerable. I don't think as women, there's a natural tendency to be a little bit more vulnerable, but I feel like as Black women, we're not always taught that being vulnerable is safe.
Right. Yeah, it's really hard to be vulnerable. Like I
said they're white. I love you too, Carolyn. We good?
Yes, we do. We love you.
I have some whites and some Asians in my family.
Right. Okay. But it's true though. In our culture, especially from women, we can be so quickly identified as an angry Black woman. So, and that's if we change our tone in any way, if it is elevated in any way, but naturally, as a Black person, we sometimes are louder or more dramatic with everything we do. Like when we laugh, we are, like everybody's falling out, or when we celebrate it, it's just so different. And when we sometimes in that same thing, we're I think, very emotional and just display it all over, because we can mourn in a way, and I could say this, I've seen this, that we can be identified as a threat because we're mourning. because we're loud, because we're crying out. And then it's you're uncontrolled. We're at risk because now you're out of control. And it's just the fact that I'm mourning. This is my mourning. I'm screaming out. I'm crying. So we do have to sometimes put on that mask and compress ourselves at the workplace and not. I remember I was watching another show, of course. Uh,
It's
and
okay.
they
I
were
watch all the
saying,
shows too.
I know. So it was I think it was one of the 911s, and there was a where all the black men who were a fire company, they got arrested. And when it was all over and said, they
Station
were
19. It was Station 19.
yes,
Station 19.
Station 19. See, we know all the shows, especially during this pandemic. It's a whole entire pandemic out here. We know all the shows now. So they were saying how he needs to put on a face. And he was like, why do I have to put on a face all the time? And I find that sometimes putting on that face, compressing our feelings can sometimes lead to these depression because we're bottling it up inside all the time. And then sometimes we might have an explosion of the feelings because we kept so much inside. Can you talk a little bit? I know we're running out of time.
I got you.
Okay.
I like y'all. This is like when girlfriends pray all the time. I'd be like, I'm here with the girls.
I just want this to be very valuable. I want to try to hit all the things that most people struggle with that I've seen even in my profession, not nowhere near clinical, so don't see that, but I see a lot. I'm paid to be observant. So I just wanted to cover that too, like that compression of our feelings.
Well, it's kind of big in two ways. On one is all of us, even though I'm a big fan of law of attraction, law of abundance, all of that stuff, that we live in an abundant world. But I do honestly practically feel like a lot of times, even though we may have quite a bit of emotional energy, that it feels finite. It feels like there's kind of a limit on the tank. And I feel like what ends up happening is the amount of energy that is expended with wearing these masks and holding everything in and trying to look the way we think the world needs us to look. It uses up vital energy. So if you're already prone or depressed or even overwhelmed in this pandemic and you had this much energy, but you're using that much energy to look like you feel good or that you feel all right.
Right,
so
right.
This leaves you with this little bit of tank. And I think what happens is you're running on E. You're literally emotionally running on E. And the amount of effort and energy it has to look all right is energy you literally just don't have to give,
Right.
which is one of the reasons I think a lot of these conversations of racial injustice and things have actually bled into the workplace, as people's tank was low enough that before, as these things happen, people had enough reserve that we didn't talk about these things at work and then we just go home and whatever happens with it. And now it can't. So I think one issue is the limited amount of energy. The other is that a lot of times those emotions will go somewhere.
Right.
So it's whether or not you end up feeling immediately more depressed, that leads some people, they'll actually start self-harming or things like that to try to have some type of emotional release. And then the other thing is not only just feeling depressed or irritable because you've been holding on to this, is then sometimes it spills over into other people. So it's not uncommon. One of the common symptoms of depression is irritability. And when your people are holding on to all this emotional energy, then it leads to snapping at being irritable or snapping at other people, or it may affect your home life. You're holding it together at work, then you get home and you don't have enough energy to do anything, or you're aggravated with everyone, or you just want to go in your room and never come out, and it just bleeds over. So it's kind of like either you're feeling more depressed or it just starts kind of bleeding out because you can only hold on to this stuff so long. The other thing that happens is it affects you physically. So you'll notice that sometimes people that tend to eat more, or even sometimes people will notice they were depressed and they gained weight, but they're like, I haven't changed how I eat, but it's their cortisol is triggered, and cortisol just makes you hold on to that weight around your belly. It's that belly weight we all hate. Is that your stress hormones get triggered, and then you're holding on to weight and other things, and you just start feeling it in your body, which isn't really going to help you or do you any good. So I think it's just making sure that we take good care of ourselves emotionally, because all these things wrap around. Because if you have depression and you're feeling bad all the time, but you're kind of holding this mask, well, guess what your blood pressure may do? Your blood pressure may go up. Now you got issues with your blood pressure being up.
Right.
Or you had issues with your blood sugar. Stress makes your blood sugars go up. So it's just everything is so connected that, and to me, it's because there is a mind, body, and spirit connection, that a lot of it starts here. If we can get this squared, a lot of this will follow suit.
That's true, because one of the things that I'm on a mission. I just had surgery on both of my feet, so I've been literally laid up for about 3 months, and of course put on all the weight because all I could do is really eat. And what would get to me so much is when people would call me and say, "So what you doing today?" Nothing. And it kind of just made me feel some type of way, that question, because I couldn't do anything. And then what am I going to do? It's a pandemic out here. There's nowhere for me to go. What do you want me to do? I'm doing nothing. So it's just really hard when situations put you, because I was used to getting up and walking every morning with my girlfriend, which helped me. I realized that was something I needed to help just start the day off right. Getting up in the morning, getting that fresh air, walking outside, that set a good tone for the day. And now without it, I am a little more irritable. Stuck in the house. Well, I help my parents, so I'm here with them. And sometimes their 101 questions kind of get to every nerve in my body that makes me. So it's just really, yes. All the nerves are just triggered. Like if you ask me one more thing. So it's just really hard. Like during this pandemic, we have been in unprecedented times of closure and non-connecting. Like one of the things that kind of is hard for me is like everyone wants to do with our cell phones. Our cell phones are always with us. We're always on them. The threads can become overwhelming for me, really overwhelming. So I came out of one right before the pandemic, but it was with my local girls, because I got girls everywhere. I expected to see them every Sunday. But then I came out of the thread. So then I'm like, dang, didn't anticipate this. But I check in from time to time, but I still get so overwhelmed by just the constant need to go, or seeing 90 messages on my cell phone. So some of that kind of builds up my anxiety of, oh, I got to read all this. And if I don't know what's going on and this, that, and the other. So sometimes those type of situations for me became very high anxiety points for me.
Well, I mean, you bring up a couple of good points. I think one is things have been highlighted in this pandemic that could have been issues before, because had you had surgery on both your feet, you'd still be stuck in the house.
Right, exactly.
The difference is if it was pandemic, your crew'd be coming over, hanging out, bringing you some goodies. All that stuff. But I think the big thing is this pandemic has challenged all of us to be creative in our solutions. And I think the hard thing has been is, just as it happened for you, is the solution for yesterday might not be the solution for today, which might not be the solution for tomorrow. So pre-foot surgery, one of the solutions was walk in with your girls, fresh air, quality time. Now your feet are jacked. Well, hopefully they're getting unjacked.
They're getting unjacked.
Then you need another solution. And I think one of the things that this is cultivating, and probably why Some people feel a little bit more comfortable than others, that if you are more naturally adaptable, then you're going to feel more comfortable because you're going to be able to stick and move. Whereas this situation has continued to change. So if you have if you're a natural person that likes routine and doesn't like sticking and moving and things always changing, it's just going to be more challenging. So I urge everyone to continue to be creative about ways that you can connect or do things. That it's like, if you were walking before but you can't walk, is there a way you can put a chair outside and just get a little fresh air? So you still get the fresh air component, it's just a little bit different. And then it's something like, well, maybe we'll FaceTime, you walk, I'll sit, but I'll see your scenery. And when you see something good, just pop it up so I can see it. But I think it's causing all of us to have to be more adaptable. And I think the other thing is, it's so easy to actually, ironically, even though we're more stationary, to become overstimulated. It's one of the reasons I encourage people sometimes, if these group chats get exhausting, this is a great time to move to different platforms such as GroupMe or Signal, WhatsApp, or something else where you can mute the conversations so that you're not getting that ping all the time. If it's on your regular phone, it's going to ping all the time. But if it's in an app, there are times where if you're like, I'm taking a little break, you just turn it off. And then you're not getting that little ping. And I think this is a great time to manage notifications, because it's so easy to get overwhelmed. When we have big news stories, you're getting alerts from everything, and I think it's good to start putting boundaries on social media, boundaries on CNN, C-SPAN, MSNBC, or whatever your news outlet is, because it's easy to get sucked in, and then that ends up making you more anxious. So to start putting limits and be like, okay, I'm going to, this is my social media timer. I'm not going to be constantly scrolling, or, sometimes put your phone on D&D so nothing's coming through unless it's an important call, just so that you're not constantly stimulated.
Right. So we got one question, and this is going to be our wrap up. How do you heal from years of Black emotional tax that you paid on a job?
I wish there was one answer to that.
I know.
Let me pray and see if God's going to give me a similar answer. I think the first thing is to acknowledge that you paid it, so that you can face it head on. The next is to make a decision of what you want going forward, because that's the great thing about this time we're in. This is a time where people are reinventing themselves left and right.
Right.
So I think one is acknowledge you had it. Next is decide what do you want for your future? What do you want next? Do you want to consider being a business owner? Do you want to consider potentially shifting to work at a Black-owned business? Just kind of what you want as far as that. The next is starting to take care of your own emotional health and healing, setting good boundaries, making sure that you're taking care of yourself, that you're fueling your body well with healthy food and healthy fluids, that you're getting sleep, that you're nurturing healthy relationships, so that you are having what you're really trying to do at the end of the day is you want to shift the balance from when you were paying that Black tax, you were pouring out. You were constantly pouring out. You want to shift the balance so that you're actually having more pouring in. So, and more restoration. So that's your sleeping, your eating, potentially meditation, gratitude, those kinds of things, and prayer, but also surrounding yourself with people that are going to pour into you, because what you're doing is you're refilling your cup.
Amen.
And then looking at what kind of thing you want to do that helps you pay the bills, unless you have a winning lottery ticket that you didn't mention you had, that I'm sure you wouldn't care about this if you had a winning lottery ticket, of how you're going to shift into that so that you can pay them in a way that do some kind of work that feels like it's hopefully purpose or passion driven. But you don't feel like you're paying as much of a tax. And if it's a situation where you paid a Black tax that's high and, your confidence is shaken, or you just feel crappy all the time, then, it wouldn't hurt getting a little professional help to help you deal with adding some other things to your toolbox.
Right, right. Well, thank you so much, Dr. Ericka. We appreciate you coming here. I want the people to know how they can connect with you, how they can find you. So please share all of the things that we can find and connect with you.
Thank you. I feel like our theme today has been all of the things,
Other things.
all other things. Um, well, the first thing I have to say is just it's been such a blessing to spend my morning with all of you. Your listeners, watchers, whatever we're going to call them, have been utterly phenomenal. They have
Yes.
been giving the most thoughtful, insightful comments. So I want to give them some acknowledgement on how great they are. And if you're interested in finding me, I'm at Dr. Ericka, DoctorEricka. That's DoctorEricka. My parents used all the letters. And I'm there on Instagram, Facebook, and all the places. But I'm probably most active on Instagram and Facebook. Also, if you're just interested in some additional practical coping strategies, I do have a complimentary ebook called The Overwhelm Blueprint Solution, and you can get that at overwhelmblueprint.com, overwhelmblueprint.com.
Amen. And if someone wanted to seek you out in your area as either a life coach or a psychiatrist, are you still taking clients?
I am. You can go to askdrgoodwin.com, 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 and you'll get information about my practice, and you can set up a 15-minute complimentary consultation there.
Oh, awesome. Awesome. So thank you so much again. We thank you for all the nuggets you shared on seasonal depression. There were some real jewels, and I pray that those that have been watching us took in those things, and they will seek out if they feel that they need some assistance, that they will seek you out, or as well as anyone in their area, just to get the help that they need. So thank you again, Dr. Ericka Goodwin, for being here, for blessing us with your presence and your knowledge of all the things when it comes to seasonal depression. So thank you again. And remember, ladies, we are Girlfriends Pray, where it is our mission to draw women closer to God through prayer. We are on the line praying every day, Monday through Friday at 7 a.m. You can check us out on Facebook. We also have a podcast on SoundCloud, iTunes, and YouTube, where you can find any prayer for whatever it is that you are in need of. We have so many topics of prayer where we share scripture and prayer. And also, I want to mention on Fridays is when we have men pray at Girlfriends Pray. And we have some powerful men praying over us, because we know one of the things that is closest to our heart is the men in our life. So invite a man on a Friday at 7 a.m. Eastern Standard Time. You can also go to our website, www.girlfriendspray.org, to find out everything about Girlfriends Pray. And we bless God for everyone tuning in this morning. And again, thank you so very much, Dr. Ericka, for giving us your knowledge on what we need to know. So thank you. Bye, everyone.